As we age, our bodies undergo various changes, many of which can be unexpected and difficult to manage. One particularly challenging shift is a decline in balance. Most people don't give much thought to their balance until they start losing it, but why does this happen? Interestingly, a significant factor in balance issues could be linked to medications you're currently taking. It's a bit ironic that the very drugs meant to help us manage health conditions can increase the risk of falls, but it's a reality for many. Welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. In today's video, we'll reveal 10 medications that can lead to loss of balance. Stay tuned until the end because number 6 is a commonly prescribed medication that many people aren't aware contributes to balance problems. You may be surprised to learn how many people unknowingly put themselves at risk due to their medications. In fact, balance issues are a side effect of dozens of drugs, although some are more prevalent than others. If you or someone you know struggles with balance, it may be worth considering the impact of medications. After watching this video, feel free to comment below with your experience and where you're from. We'd love to connect with you. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Let's begin. Here are 10 medications that are particularly prone to causing balance problems. 1. Blood pressure medications. Blood pressure lowering medications are a major culprit. Almost any drug that lowers blood pressure can potentially cause dizziness, particularly if blood pressure drops too low when standing up, leading to insufficient blood flow to the brain. This results in dizziness or lightheadedness. Diuretics, water pills, ACE inhibitors, and beta blockers are the most common offenders, and they are taken by millions of people daily. While the benefits of controlling blood pressure usually outweigh the risks, if you're experiencing dizziness, especially upon standing, it's essential to inform your doctor. They may adjust your dosage or switch your medication to better suit your needs. 2. Antidepressants. While depression itself can cause balance issues, the medications used to treat it, particularly selective serotonin reuptake inhibitors, SSRIs, like Prozac, Zoloft, and Paxil, can also contribute. Although the exact mechanism isn't fully understood, these drugs seem to affect how the brain processes sensory information, leaving some people feeling like they're unsteady or walking on a boat. For many, the benefits of these medications far outweigh the risks, but if you notice balance problems after starting an antidepressant, consult your healthcare provider. 3. Anti-anxiety medications. Benzodiazepines like Xanax and Ativan are commonly prescribed to alleviate anxiety by depressing the central nervous system. While effective for calming anxiety, these drugs can impair coordination and balance, especially in older adults. Studies show that older adults who take benzodiazepines are 44% more likely to suffer a fall resulting in injury. The risk is highest when you first start taking the medication or increase your dose, so it's crucial to be extra cautious during the adjustment period. 4. Sleep aids. Both prescription sleep medications and over-the-counter sleep aids can impair balance. Many work similarly to anti-anxiety medications by depressing the central nervous system, which can cause grogginess and unsteady coordination even after you wake up. This is why the FDA requires warnings about next-day impairment for some sleep medications. If you're struggling with sleep, non-drug approaches like improving sleep hygiene, cognitive behavioral therapy for insomnia, or relaxation techniques may offer safer alternatives. 5. Antihistamines. Many people may be surprised to learn that over-the-counter allergy medications, such as antihistamines, can negatively impact balance. This is particularly true for older antihistamines like Benadryl. These drugs work by blocking histamine, a chemical in the body involved in the immune response to allergens. However, histamine also plays a role in regulating wakefulness. When antihistamines block histamine, they often cause drowsiness, which in turn can impair your coordination and balance, increasing the risk of falls. While newer antihistamines like Claritin and Zyrtec are less likely to cause drowsiness, they can still have this effect on some individuals. If you find yourself needing antihistamines regularly, it's a good idea to consult with your doctor to determine which medication is best suited to your needs and least likely to impact your balance. 6. Pain medications. Both prescription and over-the-counter pain medications can affect balance. The extent to which these drugs impair coordination varies based on the specific medication, but many of them, particularly prescription opioids, pose a significant risk. Opioids, which work by binding to receptors in the brain, not only dull pain but can also impair balance and coordination. They are notorious for causing drowsiness, clouding judgment, and making falls more likely. Even common pain relievers like ibuprofen and naproxen, while less likely to affect balance, can cause dizziness in certain individuals. If you rely on pain medications, it's important to be aware of these potential side effects, especially if you are prone to balance issues. 7. Diabetes medications. If you have diabetes, you may already be at an increased risk for balance problems due to potential nerve damage, neuropathy, associated with the condition. However, some diabetes medications can add to this risk. Insulin and other drugs designed to lower blood sugar can sometimes cause blood sugar to drop too low, leading to a condition called hypoglycemia. Symptoms of hypoglycemia include dizziness, confusion, and an increased risk of losing balance. This risk is particularly high for those taking insulin or a class of medications known as sulfonylureas. It's crucial to monitor your blood sugar levels carefully if you're on these medications and recognize the early signs of low blood sugar to avoid potential falls. 8. Heart medications. In addition to blood pressure medications, certain heart medications can also affect balance. For example, digoxin, which is commonly used to treat heart failure and irregular heartbeats, can cause dizziness and even vision changes in some individuals. Antiarrhythmic drugs, which are used to regulate irregular heart rhythms, may also pose a risk to balance. This is partly because of their effects on the heart, but some of these drugs can also affect the inner ear, a key component in maintaining balance. If you're on heart medications and experiencing dizziness or balance issues, it's important to communicate these symptoms to your healthcare provider. 9. Parkinson's medications. Parkinson's disease is known for causing balance issues, so it might seem counterintuitive that the medications used to treat it can also lead to balance problems. While these drugs do help manage the symptoms of Parkinson's overall, some of them come with side effects like dizziness and impaired coordination. The most common Parkinson's medication, levodopa, increases dopamine levels in the brain, which can sometimes cause a drop in blood pressure when standing up, leading to dizziness and a heightened risk of falls. While these medications are essential for improving quality of life for people with Parkinson's, monitoring blood pressure and being cautious about standing up too quickly can help manage these side effects. 10. Antibiotics. Most people don't typically associate antibiotics with balance issues, but certain types, especially a class known as aminoglycosides, can cause significant damage to the inner ear. The inner ear plays a critical role in maintaining balance, so any damage can lead to permanent balance problems and even hearing loss. These antibiotics are generally reserved for treating serious infections when other antibiotics aren't effective. If you're ever prescribed one, it's crucial to understand this potential risk. However, you might be wondering if this means you should stop taking your medications altogether. The answer is a firm no. For most people, the benefits of these drugs far outweigh the risks. The point here isn't to scare you off your meds, but to make you aware of possible side effects, so you can discuss any concerns with your healthcare provider. If you're taking any medication and notice dizziness or unsteadiness, it's important to bring it to your doctor's attention rather than ignore it. They may be able to adjust your dose, switch you to a different medication, or offer guidance on managing the side effects. In addition to working with your doctor, there are practical steps you can take to reduce the risk of falls, regardless of your medications. Regular exercise can strengthen the muscles and improve coordination. Eating a well-balanced diet is equally important. We also have an informative post on our channel about the 3 most dangerous foods that can exacerbate balance and dizziness issues, so be sure to check that out. Don't forget to follow us for more exclusive health tips. Moreover, maintaining your vision is essential for balance, so schedule regular eye checkups. Small home adjustments can also make a big difference. Remove tripping hazards, improve lighting, and install handrails where necessary. Standing up slowly allows your body time to adjust to changes in position, reducing the risk of dizziness. Stay hydrated, as dehydration can lead to lightheadedness and increase fall risk. Be mindful of alcohol consumption, which can interact with medications and exacerbate dizziness. It's also a good idea to review your medications with your doctor periodically, particularly as you age or your health conditions change. As we get older, the body's ability to process and eliminate drugs diminishes, leading to higher concentrations of medications in the system, which can increase the likelihood of side effects. The liver and kidneys, which filter and clear drugs from the body, become less efficient, and the brain becomes more sensitive to certain medications. Older adults also tend to take multiple medications, which can interact in complex ways, raising the risk of balance issues. If you're a caregiver for an older relative, make sure their healthcare provider reviews all their medications, including over-the-counter drugs and supplements. It's easy for anyone to take medication without fully understanding its potential side effects. Medical information sheets are often filled with jargon, and doctors may not have the time during a brief appointment to cover every detail. But we, as patients, can do better. Be proactive about understanding the medications you or your loved ones are taking. Don't hesitate to ask questions. Why am I taking this drug? What are the possible side effects? Are there alternatives? Doctors and pharmacists should also take the initiative to discuss balance-related side effects, especially for older patients or those on multiple medications. Balance is not just a physical process controlled by our muscles and inner ear. It's influenced by a complex interaction between sensory input, brain processing, and motor control. Knowing how these systems work together can help us take a more comprehensive approach to our health. So, the next time you pick up a prescription, take a moment to read the label carefully and ask questions. If you start feeling dizzy or off balance, don't just chalk it up to aging, talk to your doctor. Sometimes, a simple solution like adjusting the dose or switching medications can make all the difference. We'd love to hear from you. Are you currently taking any of these medications? Have you noticed any balance issues? Share your experiences, questions, and tips in the comments. If you found this video helpful, type yes below. Don't forget to like, subscribe to our channel, and hit the notification bell so you never miss an update. Share this video with your friends and family to spread awareness about medications that could lead to balance problems. And before you go, check out these 2 recommended videos that we think you'll love. Stay healthy, and have a wonderful day.